our webinar. We're going to go ahead and just get started. And if others start to trickle in, we'll just keep moving. So today's webinar is going to be just some basic info specifically targeted towards birthing hospitals. There's been some changes and we wanted to just inform you all about what those changes look like. Today's webinar is going to be presented by Josephina Rocky, who is our QA team lead. Next slide. So just some quick housekeeping things. Please ensure that you're muted throughout the presentation unless you are speaking. For the QA team, just remember to monitor the chat for any questions you might be able to answer. And then for the attendees, today's session is going to be recorded. So the slides and the webinar recording will be uploaded to the link shown there. And you can go back and refer to it if you need to. If you're not already a part of our email list and you'd like to be added, you can go ahead and give us an email at the email listed there. And in the subject line, please write email list and yes. Next one. And then for any questions you may have today, please use the chat to ask your questions so that the VFC program team can respond directly to you. And we will be answering any questions you may have at the end of the presentation. Next slide. So I'm going to go ahead and hand it off to our presenter today. So go ahead, Josephine.
Hi, good morning, everyone. My name is Josephine, and I'm part of the quality assurance team for the VFC program. Our objectives today, by the end of the presentation, attendees will be able to understand the Vaccines for Children program requirements, describe VFC eligibility requirements, and identify storage unit requirements. So the VFC program requirements annually, we do have re-enrollment, so submit to the Hawaii VFC program annually by January 31st of each year. Your provider agreement, your vaccine management plan, which needs to have been reviewed within the past 12 months, reviewed and signed. Certificates for You Call the Shots modules 10 and 16. For the backup and primary coordinators, we don't require your entire staff to do the modules, but we do recommend that anyone that handles the vaccine, administers, prepares, do complete the modules. The only requirement will be for the primary and backup coordinators. Annual re-enrollment must be completed by January 31st of each year. After January 31st, the vaccine ordering will be suspended until re-enrollment is complete. So we'll need to have all of those documents that I mentioned. If you have any changes to your primary or backup coordinator, please let us know, and we'll request that you fill out a form for the new coordinator as well as submit the certificates for modules 10 and 16 for them as well. So all key staff must undergo the annual training. As I mentioned, that would be the primary and backup coordinators for our requirements, possess working knowledge of VFC eligibility criteria, understand that VFC is provided at no cost to the provider as well as to the children and their families. There is a fee cap for the administration fee for non-Medicaid VFC eligible children. It must not exceed the state cap of $23.11, as well as document eligibility status at each immunization visit. And any documents that you're sending us, if you are sending us temp logs, which we do require monthly, we request that you email them to our email address at hawaiivfc@doh.hawaii.gov. And in the subject line, if you could include your location name, the PIN number, as well as the document that you are sending. We do get quite a few emails, and if the subject line, if you include that info, it helps us a lot as we are sifting through our email. So who is eligible to receive VFC vaccines? To be eligible, the child must be less than 19 years of age and one of the following. They need to be Medicaid eligible, uninsured, American Indian or Alaskan Native, underinsured, a child who has a private health insurance, but the insurance doesn't cover vaccine, or if they have insurance, but it only covers certain vaccines, Underinsured children are eligible to receive VFC vaccines only through an FQHC, which is a federally qualified health center, or a rural health center. No other factor can be considered when screening for eligibility. Newborn eligibility. Newborns are classified as insured based on their parents' insurance at time of birth. For mothers on Medicaid, I did verify with the CDC as in most circumstances, if Medicaid pays for the birth, the newborn must be enrolled for a year. And if you want more info, I have the link listed. I also do have a PDF of the slides, the PowerPoint slides in our chat, if you would like to open it up and follow along. Nursivimab eligibility. So VFC criteria, they need to be uninsured, Medicaid MedQuest enrolled, or reasonably anticipated to be Medicaid MedQuest eligible based on their parent and American Indian, Alaskan Native, regardless of insurance status. Nursivimab is not purchased with 317 funds, so it's a little different with their category. Hepatitis B vaccine eligibility. They're purchased using VFC and 317 funds, and they do have different eligibility criteria. For VFC, it's the same as I mentioned, uninsured, Medicaid, MedQuest enrolled, or anticipated to be based on their parents' insurance, American Indian, Alaskan Native, regardless of their insurance status. And the criteria for 317 is privately insured or reasonably anticipated to be privately insured based on their parents' insurance. Hepatitis B immune globulin. It's not purchased with VFC funds. It can be administered to infants born to an HB, AG negative positive or unknown mother, regardless of infant's VFC or 317 eligibility status. So as far as documentation goes, all records must include patient's name, their date of birth, eligibility status, the name of the vaccine that was administered, along with the date the vaccine was administered, the date the VIS was given, and the publication date of the VIS as well, the name of the vaccine manufacturer, vaccine lot number, name and title person who administered the vaccine, and address of the clinic where the vaccine was administered, or hospital in this situation. Documentation for Nursivimab. The eligibility and administration may be reported via the Hawaii Immunization Registry, as well as the VAVR, the Vaccine Administration Visit Record. If there is not a category listed for Nursivimab, you just put it in the other field. Again, to reiterate, Nursivimab is not included in the Hawaii Immunization Branch Universal Pediatric Hepatitis B HBIC program, so administration cannot be reported on the newborn hepatitis B vaccine record form. So the Hep B HBIC vaccine eligibility and administration is reported through the completion of the form I just mentioned, the HDOH supplied hepatitis B vaccine record form, and electronic submission to HIR. More VFC program requirements. You must maintain immunization records in accordance with the law for a minimum of 3 years. You do not need to keep paper copies. You can scan and download the documents into the patient's chart that is acceptable to save some space. Develop, maintain, and implement a vaccine management plan. And as I mentioned, it needs to be reviewed annually. And when you have any changes, it would also have to be reviewed and signed. Provide all ACIP recommended vaccines unless qualified as a specialty, which birthing hospitals are. So you would just have to provide the Hep B, HBIC, and Nursivimab. Provide current, most recent publication date of the VIS to patients prior to, or patients' families prior to each vaccination, and report any adverse events to VAERS, And there's the website there at vaers.hhs.org. You are able to submit a report online. Review downloaded digital data logger routinely every 2 weeks. This has really helped our providers be able to catch temp excursions that they may have missed for some reason. An alarm didn't go off. So if you review the DDL data, you can see and be able to address the issue as they occur. Submit temperature logs monthly. Submit even during months when you're not going to place an order. Report temperature excursions once they have occurred. The reason we stress this is because once we can clear you of your excursion, there won't be any holdup when you place an order. If we do notice that you have an excursion as we're going through your temp logs and you have an order pending, we won't be able to process your order until we have cleared your excursion. Submit vaccine loss reports weekly. And vaccine borrowing, meaning between private and VFC vaccines, it must be a rare and unplanned occurrence, and it can be bidirectional, except actually in the case of nirsevimab, it is, you cannot borrow from VFC and give to private. Borrowing logs must be submitted once they are completed. Primary and backup coordinators. If the vaccines are going to be stored in the hospital pharmacy as well as in the birthing unit, this is a change that we've made. Each location must have a primary and backup coordinator. And they would also need to complete the modules 10 and 16 for both locations. So for the pharmacy as well as the birthing unit. So VFC site visits are compliance visits. We conduct them anywhere from 13 to 24 months from your prior site visit. And we can also have unannounced storage and handling visits. These can occur at any time. Site visit follow-up requirements must be completed by the due date. If they're not met by the due date, vaccine ordering will be suspended until requirements are completed. And that is also true if you do have a temper excursion and we haven't cleared you, your ordering will be suspended until that temperature excursion has been cleared. Storage unit requirements. Acceptable storage units are pharmaceutical grade, standalone, or combination units. For hospitals, this probably will not pertain to you, but household and commercial standalone units are okay. But if you provide frozen vaccine, a separate freezer is required. After July 1st, we will no longer be allowing the use of the freezer section of a combination household unit. Dorm and bar style units are prohibited, and the storage unit must have enough space to accommodate vaccine stock at your busiest time of the year. So when you'll have the most vaccine. For pharma, the next part talks about water bottles and frozen water bottles. These mainly pertain to household and commercial units. If you have a pharmaceutical grade unit, check with the manufacturer regarding water bottle placement. Label storage unit outlets and circuit breakers with do not disconnect labels, and have emergency transport supplies such as a styrofoam cooler, bubble wrap cardboard readily available for emergency transport of vaccine. The vaccine transport. So for routine transport of vaccines, a qualified portable storage unit or qualified pack-out is required. The styrofoam coolers they don't qualify for routine transport. That is limited to emergency transport of vaccines. And the ice packs cannot be used with transport for vaccine because they can inadvertently freeze the vaccine. And once vaccines reach the frozen state, they're generally unviable. So proper temperatures and monitoring. You need to have a continuous monitoring system, which is used with the DDL, the data logger. There needs to be a detachable probe in a buffered material. The temperature must be able to be read from the outside, and the certificate of calibration must be current and valid. We've noticed that DDLs with an expired certificate of calibration tend to start not reading accurately anymore. What is calibrated is the probe. So if you're going to change out your DDL with the new one, we've noticed that people will just leave the probe and change out the monitor, but it's actually the probe that is calibrated. So if you're going to change out your DDL, change out the whole thing, the probe as well as the face, the monitor. DDL probes should be placed in the central area of the unit directly with vaccines. They should not be placed near the doors, against the walls, close to vents, or on the floor of the unit. For your temperature logs, there must be at least 2 temperature readings per day. The time and date of each reading, initials of person who assessed and recorded readings, DDL min and max temps once per workday. We know that some places like to send the downloaded DDL data, but if it doesn't show who logged in to check it, we can't accept it. We would still need the standard temperature log. And as I mentioned, review downloaded DDL data regularly every 2 weeks. In the future, we may require that the DDL data also be submitted, but at this time, we are not required. So proper temperatures for refrigerated vaccines. Temperatures must be between the 2 degrees Celsius and 8 degrees Celsius. Anything outside of this range is considered a temperature excursion. So if you have any questions, just contact us and we can talk you through the process. Generally, as I mentioned, if it does go below 2, though, we have found that manufacturers have found the vaccines to be unviable. So temperature excursions. Document all excursions. Quarantine and label any exposed vaccines do not use awaiting guidance. And take those vaccines and place it in a unit with proper storage conditions. Let us know as soon as the excursion occurs and contact the vaccine manufacturer to obtain documentation of vaccine viability. Do not use the stability calculator that is found online because it doesn't take into account previous excursions that the vaccine may have been exposed to. Complete and submit the troubleshooting log, the downloaded DDL data, manufacturer correspondence to the Hawaii VFC program at the email address, hawaiivfc@doh.hawaii.gov. Vaccine accountability. So the Hawaii VFC program, our responsibility is to develop and maintain vaccine accountability systems, which ensure that vaccine loss and wastage is minimized, protect against fraud and abuse, and ensure that the vaccines purchased with VFC funds are administered only to VFC eligible children, ensure the proper apportionment of vaccine purchases based on VFC eligibility data for population. That's why all of the documentation is important, because that's how the CDC determines how much vaccine our state receives. Provider accountability. It's important that VFC providers account for and store VFC vaccine appropriately to avoid loss of vaccine due to expiration, storage and handling issues, and administration errors. I believe the total cost last year for vaccines due to expiration, handling issues, waste, came out to a little, about 500,000. It was in the 500,000 range. I don't have the exact amount, but we did send out an email regarding that loss. So we want to minimize that because that is a lot of money. Also for provider accountability, reasons of negligence. These are examples. They're not limited to the following, but include not being able to receive a vaccine delivery during stated vaccine delivery hours, failure to store vaccine promptly upon arrival, storing vaccine in a refrigerator or freezer unit that cannot consistently maintain the required temperature range, freezing vaccine that is supposed to be refrigerated or refrigerating vaccine that is supposed to be frozen, unless you are preparing to file a vaccine. Failing to check and document vaccine storage temperatures twice per day, failing to download and review DDL data for any out-of-range temperatures, failing to follow vaccine storage alarm response protocol for power outage or unit failures, failure to rotate vaccine stock resulting in expired vaccine, and any other preventable incidents made by providers. I believe we even had one instance where an incorrect zip code was entered and the vaccine got sent to a different island, and that resulted in vaccine loss. So in order to order nirsevimab, it's not included in the Hawaii Immunization Punch Universal Pediatric Hep B HBIG program. Hospitals may order 50 milligram or 100 milligram doses, though to limited supply, VFC ordering for the 50 milligram dosage is restricted to birthing hospitals only. And the order may be placed via the nirsevimab monoclonal antibody order form. Hepatitis B vaccine, HBIG ordering, you complete the birthing hospital vaccine order form. You submit the order form for Hep B and HBIG by email at doh.hawaii, or I'm sorry, the email address. You can use that email, but our preferred email address is hawaiivfc@doh.hawaii.gov, or by fax at 808-586-8302, though we prefer you email because sometimes our faxes get lost. Hep B vaccine orders for VFC eligible and non-VFC eligible, which are the 317 patients, must be indicated as separate line items. Doses administered and doses on hand information specific to VFC and 317 must be reported when vaccine or HBIG orders are placed. The total number of HBIG should not be more than 10 doses per order, and all orders received from birthing hospitals will be given priority over standard VFC provider orders. But we lately have been having issues with the shipping with UPS, so delivery may take up to 2 to 3 weeks. So if you could plan for that when you are placing an order. Fraud and abuse. We bring this up because this is one of the requirements for CDC. The definition of fraud is intentional deception or misrepresentation made by a person with the knowledge that the deception could result in some unauthorized benefit to himself or some other person. Any act that constitutes fraud under applicable federal or state laws. The definition for abuse, bear with me because it is kind of long. Provider practices that are inconsistent with sound fiscal, business, or medical practices and result in an unnecessary cost to the Medicaid program, and or including action that result in an unnecessary cost to the immunization program, a health insurance company, or a patient, or in reimbursement for services that are not medically necessary or that fail to meet professionally recognized standards for healthcare. And also includes recipient practices that results in unnecessary costs to the Medicaid program. Examples of fraud and abuse: providing VFC vaccine to non-VFC eligible children, selling or otherwise misdirecting VFC vaccine, billing a patient or third party for the VFC funded vaccine, charging more than the established maximum regional charge of $23.11 for Hawaii for administration of a VFC funded vaccine to a VFC eligible child, denying VFC eligible children VFC funded vaccine because of parents' inability to pay for the admin fee, failing to implement provider enrollment requirements of the VFC program, failing to screen patients for VFC eligibility at every visit, failing to maintain VFC records and comply with other requirements of the VFC program, failing to fully account for VFC funded vaccine, and failing to properly store and handle a VFC vaccine. ordering VFC vaccine in quantities or patterns that do not match your provider profile, or otherwise over ordering of VFC doses of vaccine, as well as a wasted VFC vaccine. And this would be if a provider were consistently doing these actions. If it's like a one-off thing, then that's generally not reported. But if we do see a pattern of issues such as this occurring with the provider. What is also required annually is to complete the facility agreement for the Hawaii Immunization Registry for HIR. It is available online and you can complete that online. Each HIR user must complete the confidentiality and security statement. If either of the above are not completed by January 31st of each year, HIR will disable the account until it is completed. If you have any questions regarding HIR, please contact HIR at registryhelp@doh.hawaii.gov or by phone at 808-586-4665. For neighbor islands, we do have that 188 number for you as well. For resources, I did put in the chat the link to the Hawaii VFC program website. We do have our online VFC provider reference toolkit available there, though we are in the process of updating the toolkit. We will be adding a section that pertains to birthing hospitals. We also do have a YouTube channel for the Department of Health YouTube channel for VFC, as well as a Hawaii Department of Health general YouTube channel. We have a playlist of our past webinars listed there. I have a link to the Hawaii Immunization Registry website. And I've also included the CDC VFC Operations Guide link to where that's accessible to you now. Previously, they didn't publish it for the public, but is listed on their website. And they do have an addendum for the Nursivana and COVID-19 on there as well. Here's our contact info. If you have any program or VFC questions on VFC site visits, my name is listed on there as well as the rest of our team. And then for any VFC vaccine ordering questions, this is their contact info as well. We do have a post-webinar satisfaction survey that we ask that you complete. We will post the link. Looks like Kayla, he just posted the link. If you could complete it and if you have any comments or questions, or if there is any topic you would like us to discuss in a webinar, please list it there. We do review it. And now if you have any questions, feel free to post it in our chat, or you can unmute yourself.
Just so that other people can, Hi, it's Alicia from Hilo. Would you be able to send this video PowerPoint to our emails?
We will have it listed on our website. The PDF is in the chat, but the links to our videos, and the links that I mentioned, they'll be there too. And if you go to that website there, it'll be available in the chat. Hi, Joni, you have a question?
Yeah, quick one. Are we required as a birthing hospital to participate in the VFC program, or is it an optional program?
If you are going to be providing VFC vaccines to your eligible children, then it is required that you participate. But I will probably need to get clarification with that though first before you taking that as an answer. Because we don't, otherwise our children that are eligible may not be able to receive the vaccines, especially those that meet the 50 milligram requirements, because we are reserving those doses only for birthing hospitals at the moment.
Well, I'm not talking about Nursivana, I'm talking about Hep B.
Okay. That's funded differently. I'll have to get back to you on that for Hep B.
Okay. Well, the reason I'm asking is after our site visit a couple of months ago, where we've been having multiple meetings with the people that build our EHR, and they're having difficulty with coding the VFC admin fee. So we have somebody manually changing that for every VFC eligible patient to that $23.11. But that's not a sustainable process. So we're almost wondering if there's an option for us to not participate in VFC if we can't be compliant with this administration fee.
The Hep B admin fee.
Yeah.
Can they list it as a separate item?
Well,
Or
I it has to do with the whole Cerner build, and I'm not smart enough to like understand all of that. Because we're trying to automate it, obviously, because having one person manually track all of this stuff, it's just not sustainable.
yeah, especially with the amount of children that are in newborns. I can
Right.
understand that.
So, well, the other option or the guidance from our system office has been for birthing hospitals to not participate in VFC programs. And we'll just have to purchase all of the Hep B, Hep B vaccines.
Okay, I'll actually have to talk. We'll have to talk about that and get back with you. I don't want to misspeak something that's incorrect.
Okay, sounds good. Thank you.
Thanks for that question, though. Does anybody else have any other questions? And if your site is due for a visit, you can reach out to us. Otherwise, what we do with the site visits is we'll plug in a date because our schedules are so very tight. And there won't be much option. We are trying to work on a way to have providers go on, with the exception of neighbor islands, to go online and be able to schedule themselves, but we're not at that stage yet. Right, if no one has any other questions, that is the end of our webinar for today. But you do have our contact info. Please feel free to email us if you have any questions. Joni, I'll email you back to your email address with your question. And once we can determine, I have to talk to the immunization branch.
Thank you.
And once we do have something, we'll usually put it out in our weekly announcements that we send in the news that you can use as well. And thank you everyone for attending. I hope it was helpful. And like I said, please reach out if you have any questions. Thank you.
Thanks.